Thank you, Jocelyn. A very good evening and good afternoon wherever you are. And my name is Fazila, and together with Dr. Fairuz Zaman, I'll be presenting to you our journey for the OH Regulatory Lab. My presentation today will be on the Online Healthcare Regulatory Lab, and our tagline has always been regulate to innovate. So there'll be two parts to this presentation. The first one, I'll be presenting the introduction and how we got to where we are today. And then Dr. Fairuz Zaman, as also the Secretariat for the OHS Regulatory Lab, will continue the presentation. Oops, it's not moving. Just hold on, sorry, the slide is not moving. Oops. Is it moving?
Not yet, Dr. Fazila, maybe there.
Now? Yeah,
Yes.
okay.
Thank you.
All right, sorry. This is the definition for our online health services. It's actually healthcare services which are provided to a client by a healthcare professionals, intermediate by a specialized digital platform. We came out with this guideline during the online healthcare services under the regulatory lab. And there are three parties to this. One is the patient. The patient receives the healthcare services at the preferred location, followed by the online health service platform provider. However, the provider, there are three types of provider here. Either they can be a business entity by itself, providing the whole service end to end, or a technology company who's only intermediating between the patient and the healthcare professionals. Or it can also be a hospital or clinic who's giving this entire platform for their patients. And on the other side is the healthcare professional who will be delivering the healthcare services. They can be either employer or owner of this business entity, or they can just be doing a locum and using the platform as an intermediary. And so, like I mentioned, they can work independently or employed by the hospital or the clinic. These are the four categories that we have defined in our final report from category 1 to category 4. Category 1 is mainly information and booking. So these are some of the example of companies in Malaysia. Category 2, it will involve either home care or visits. Category 3 is purely telemedicine or e-pharmacy, where the healthcare services is provided via this, and also medications. And category 4 can be combination of any 1, 2, or 3. And some companies have moved from over the years from category 1. During the COVID, they may have moved up to category 2 or to even to category 4. So these are some of the examples. But why we need to, and what needs to be regulated? The most important is regulation in healthcare is very important to limit or avoid risk of harm to patients during treatment or care. So that has been the main objective in healthcare is to do no harm. So why do we need to regulate? Because without regulation and standards, it's difficult to ensure these online health service providers comply to 5 guiding principles of healthcare service, mainly safety, quality of care, accountability, traceability, and confidentiality. So standards are very important to ensure good quality of care. And what needs to be regulated? So in our journey, we are talking about regulating the platform provider, the services. And the online health services provider can be variable from services with very minimal risk to the patient. For example, category 1 is just information or booking for appointment and may not even require regulation. So the regulatory lab is to understand all the various models of online health services out there and allow appropriate regulatory instrument. For your information, the online health services has started in Malaysia since 2015, but somehow has picked up very much and had a trajectory during the COVID. This has been our journey, very long journey. We actually started in 2017, where the online services provider themselves actually came to us. So it's actually a bottom-up approach. They knocked on our door asking for them to be looked at, to be recognized, to improve investors' confidence. And also insurance were not reimbursing patients at that time because they were not recognized by Ministry of Health. So we had industry dialogue, we had a lot of discussions. Our team even visited the LEAP program in Singapore. Singapore is quite ahead of us in coming up with a regulatory lab. And then we did a lot of workshops. And then we had a consultancy, and we came up with a online health services regulatory framework by the appointed consultant. Dr. Zaman will present afterwards. I'll present on that. In 2021, we came up with a guideline. This is the base guideline. So from this guideline is how we are going to improve further. But this guideline for the time being is as it is today, with all the regulation and acts out there as it is today. And in 17 February this year, we commenced the online health services regulatory lab. So it was a long journey because it was something new, and we didn't know how to do it. We also learned from other countries and did a lot of literature studies on this. So in March 2020 to January 2021, Ministry of Health commissioned a study. And this is the outcome of the final report, where we also did a public consultation survey in October 2020, where 96% of the public agreed that online services should be regulated. So we were shifting from a traditional fix and regulate to more agile and outcome-based and risk-based kind of regulation. So during the study, we came up with the OHS regulatory framework, as you see it here, where there are many types of regulation. Either we don't have to regulate, there's no regulation, or we can self-regulate. There's a lot of telcos out there in Malaysia who are self-regulating, or we can co-regulate, or we can have very strict government regulation. So these were some of the models that we had. And we also have different categories. So the main intention is to find out the right regulatory instruments. And what are the challenges in regulating this OHS? Of course, as you know, technology advancement is faster than regulatory change. And healthcare system is complex. There's a lot of overlap regulatory ecosystems. So our solution, we had two. Short term, to come up to do a regulatory sandbox, to come up with soft law or some interim regulation, and perhaps long term, we can amend whatever existing regulation or acts that out there, or even come up with totally a new regulation. These are some of the definition of the regulatory instruments. I'm not going through this in detail, but I've already explained to you there are many kinds of regulation, from a simple no regulation to a very strict government regulation. So we had a lot of regulatory challenges because technology was advancing very fast. The online health services also evolves very fast. And especially during the COVID, they can move from category 1 to category 4 in overnight. And healthcare, as you know, is a very complex. There's so many regulation out there. So you can either choose regulate and forget, or regulate and innovate. So when we did a study in Malaysia, there's a lot of acts out there that is related to Ministry of Health, healthcare. There are about 28 acts and a lot of subsidiary acts. We also have acts that belongs to other agencies but will affect digital technology regulation, or also service regulation. So you see, if you see, there are many acts, more than 100 over acts. These are some of the examples. This is the acts for the healthcare services, where we have act that is related to person, the profession. This is all in Malay language. It can be for the Medical Council, it can be the Dental Act, it can be the Midwife Act, Nursing Act. There's also Allied Health Act. And recently, we also came up with traditional and complementary acts, and so many acts. But there are also acts that governs the equipment or the tool or the product. For example, the Medical Device Act, or for the drugs, for example, the Poison Act, and Drugs Acts, and so forth, and also Advertisement Act. There's also act that governs the service. It can be the Private Services Act, or the Mental Health Services Act, or the Aged People Act, and also the Laboratory Act. So if you see in healthcare, there are 3 types of acts. Either it governs the person, or it governs the service, or it governs the tool and the equipment and the product in the service. So it's very complex in healthcare. At the same time, we also have act that is not directly under Ministry of Health, but it will govern ICT in healthcare. For example, the Communications and Multimedia Act. The Digital Signature Act is very important, especially for e-pharmacy. Computer Crime Act, of course, Personal Data Protection, Postal Services Act, and the Electronic Commerce Act. So with that, now I pass to Fairuz Zaman to continue the presentation. Zaman, I pass to you.
Yeah, thank you, Dr. Fazila, and greetings to everyone. I hope my voice is clear for all. Okay, so we call it the Reg Lab, short for the regulatory lab, close easier. So Reg Lab is a controlled environment where participating OHS platform providers operate within a specific condition and time frame under the guidance of the Ministry of Health and relevant regulators. And the Reg Lab is voluntary. The objective of this Reg Lab, firstly, is to understand and study the OHS provided by the platform providers. We use platform providers as a phrase to explain the companies or the entities behind these digital platforms. And secondly, to co-create appropriate regulatory and non-regulatory instruments in collaboration with various stakeholders. So MOH leverages on the existing National Regulatory Sandbox for this initiative. MOH collaborates with Futurize via the National Regulatory Sandbox. National Regulatory Sandbox, or NRS, is a strategic collaboration between government, academia, industries, and entrepreneurs, which aims to expedite progressive and anticipatory regulatory intervention. Futurize is a company under the Ministry of Finance that have been mandated by the Malaysian government to lead the National Regulatory Sandbox initiative, and MOH leverages on this National Regulatory Sandbox. So with Futurize, we have a memorandum of agreement starting from March 2021 until the end of 2023 for this regulatory lab. For the OHS regulatory lab governance, it follows the pattern that Dr. Fazila has explained earlier, which is the healthcare input consists of the person, the product or equipment, and the place or facility, and in the case of digital platforms, the environment. So for the person, we have all the councils, all the divisions responsible for the professionals, the healthcare professionals, such as the Malaysian Medical Council for doctors, oral health for dentists, nursing for nurses, and so on and so forth. We also have the Pharmacy Enforcement Division, and also the other such as Information Management Division, and also Personal Data Protection Department for other aspects of the technology. For our main OHS stakeholders, it is at the top is our patients, at the public, the users of the OHS service. Also, there are the platform providers, the regulators within MOH, and others, the government agencies, and also the healthcare professionals that delivers the actual healthcare services. For the challenges and concerns of the platform providers, there are many. Firstly, there is a lack of regulatory guideline on practice of virtual consultation, home care, OHS, and also medication delivery. Second, there's also excessive regulation may lead to unhealthy competition and hinder the growth of innovation. That is why we like to collaborate with them to co-create the regulations. Third, lack of policy and guidance on data ownership, residency, protection, and privacy, especially with medical data, which is very sensitive and needs to be controlled and regulated. 4, lack of emphasis on verification of healthcare professionals and clients of OHS. 5, lack of government recognition of OHS leading to difficulty in obtaining funding from investors and professional indemnity coverage for ACPs enrolled on respective platforms. So, for example, we have there are companies approaching us since 2017 because they do not have any method to register their services, and because their services have not been given any validity by the government, they have problems to have funding and from investors and growth. And lastly, lack of government supervision for the technology solution. So what are the platform provider roles in the OHS regulatory lab? Firstly, they are here to assist the regulators understand OHS by providing information about the service and to notify if there are any changes. So the business models of the OHS may change according to the technology and by the growth of industry itself. To identify risks and safeguards by reporting any incidents along with corrective and preventive actions taken. This is in line with the healthcare principles of safety. To use the OHS guidelines, give feedback and suggest alternatives to improve the guidelines, which is one of the main activities for the first cohort. And we have received quite a large number of input for the OHS guidelines itself. And to share challenges and provide input or suggestion for the best practices. So this dialogue between the regulators and the OHS platform providers, mostly we will discuss about the challenges and the input, and also to provide data required by the MH to make relevant policies such as number and type of clinical care handled by the platform providers for MOH to make a better decision on the best method of its regulatory instrument for them. And we do this via regular discussions and reporting with the platform providers. For the first cohort, we opened it from 18 February to 31st March of 2022. And for the second cohort, it is from 25th October to 15 November 2022. So for the general enrollment criteria, for now, it is very loose actually. The criteria is the platform providers must have a form of registration at SSM. The company must be registered in Malaysia. They must have a presence in Malaysia and also have a PIC. And also they must give some sort of company profile to us for us to understand more about their services, and also need to declare the management the qualification of their management board of directors. So for the first cohort, there are 34 total applicants, completed submissions that we have received, and after the technical working group evaluation, there are 30 and 27 accepted the terms and signed and accepted the terms and conditions and are officially operating inside our regulatory lab. So for the second cohort, we just have closed in the middle of November, and we are currently in the evaluation phase. So who knows how much the number this time. So it is already expected for the second cohort, it will be lesser numbers than the first cohort. Okay, so what is our expected output and outcome of this reg lab? Okay, it is a clear policy, regulations, standards, and guidelines, which is co-created and decided together with the industry and also the regulators, and taking into account all the other stakeholders such as the public and the healthcare professionals delivering the service. So for the short term and interim term, there's implementation of soft laws, for example, guidelines, and for the long term, we may decide on whether we need to amend or create new relevant laws regarding the online healthcare services. So with this, we can there will be recognition of the quality of OHS, public and investor confidence, growth of safe innovation in healthcare, and resultingly better health outcomes for all. So about the guideline is version 1.0, currently at version 2.0 and counting. So it is developed based on the Ministry of Health's 5 guiding principles of healthcare services. So safety, quality, traceability, privacy, and accountability. So for the objective is to set the requirements and recommendations for parties involved in the provision of OHS in the OHS Reg Lab. It is a living document. It will be further improved and refined as we receive more input from more companies, more platform providers inside the regulatory lab. and the OHS platform providers are encouraged to use the guidelines and propose alternatives if they encounter any difficulties. So these are just the overview of the contents of the guideline. We have the scope of the guideline, general enrollment criteria for platform providers. For now, it is for the RegLab, requirement for platform operations. Data protection has a specific part for itself because of its importance nowadays, and also recommendations for healthcare professionals. Okay, these are the main contents of the guideline. For the requirements for platform operations, we divided into the platform operation and the platform technical requirements, or the technology part. So for the platform operation, one of the main key items such as the registration and verification process for the healthcare professionals and also for the patients using the digital platform. Secure communication channels, how medical records are kept and handled, how the healthcare professionals are matched with the patient, regarding rules regarding advertisement and promotion, user training, and also not importance is for the companies to be compliant with the current laws, and also for the platform providers to report any misconduct occurring during the regulatory lab. So for the data protection part, there is safety and security of data, where the location of the confidential data, use, and the ownership and stewardship of the medical data. So these are the recommendations for healthcare professionals. For the healthcare professionals, they are bound to their own code of professional conduct for the ethics, and also their other regulations for the registration. So these are the recommendations in case that the healthcare professionals need to refer to this guideline before using this OHS to deliver service. So we have recommendations for qualification to practice, insurance, standard of care, establishment of patient-doctor relationship, and regarding informed consent. And most of the contents of the recommendation are already inside of the code of professional conduct or in the ethical guidelines. So for our plan of action, this is just an overview for 2022 and 2023. For the early part of 2022, we have opened and received our first cohort, and there is a stakeholder engagement at the February and on August of 2022. Currently, we have received applications for the second cohort, and currently in evaluation phase. And in November, we had an industry roundtable regarding digital signature, which is one of the main issues that we have received input from the platform providers. So for the 2023, we will continue with a continuous discussion and report analysis with the platform providers and revision of the guideline. And the MOH futurized collaboration is planned for until end of 2023, but who knows? So these are the examples of the strategic communication, the posters that we use to promote the second cohort and the first cohort to the beta platform providers. So these are the various activities of the OHS regulatory lab. So most consists of discussions and stakeholder engagements and industry roundtable with the platform providers. So we do it at the MOH headquarters in Putrajaya, or in Futurized, or in such as the digital signature industry roundtable, we do it in MCMC Cyberjaya. So in conclusion, the MOH OHS Reg Lab is a venue for collaborative discussion among various stakeholders to co-create standards and guidelines and to identify appropriate regulatory and non-regulatory instruments for OHS. So the main output of the lab is a regulatory approach that benefits all, protects patient rights, and facilitates growth of safe innovation, and also foster good regulatory practices and effective enforcement. So regulate to innovate is recommended by allowing flexibility in a controlled environment and agile regulation implementation to manage risk effectively with a focus on quality-based outcome. Okay, that is all. Thank you.
Thank you so much, Dr. Fazila and Dr. Fairuzaman, for the insightful sharing on Malaysia's experience with OHS Reg Lab. So now will be the Q&A session. So we'll start with the question from Sir Jai.
My question is this, a very comprehensive presentation, really very helpful. Just wanted to ask, like, are the solution providers register online and then give those credentials that I think some of them like company profile and things like that, which is I saw them mention. And then is there any particular timeline for their solutions to be evaluated, or is it kind of open-ended? And then the third question is like, in case somebody falls short of the expectations, is there a mechanism by which like it does happen in many of the innovative areas, especially with the startups? They may come up with very, very innovative solutions, but they may not have the requisite resources, unlike the big companies. Is there a mechanism in Malaysia that where such solution providers will be handheld or supported to come up to the expectations? Thank you.
Okay, thanks, Jai. Actually, the entire registration when we open for cohort is done on a platform which is done by Futurize. As you know, in fact, Futurize is also online today. Tengku Azrul is online. So we collaborate with them. Since Futurize has already the lead for the national regulatory sandbox, which actually started for fintech. So they already have a platform and a registration, everything is done online. So once then even our evaluation is done online, we have a checklist and everything is submitted online. So that is for the first question. But somehow after, and because this is the first time we are doing, after undergoing the first cohort, we realized there are, like you say, there are still some companies who are still very young in setting up and may not have certain things that we require. So we started to be more flexible in mandatory requirements of information. So we are improving also the details that we need. And we also trying to facilitate, because some they have intention of becoming a provider, but they have not started. So we talk to them, we try to understand, and we also sort of encourage them how to move on. So we do a lot of this, but as I said, this is a journey we are doing together, and we are still learning, and we hope by end of next year we can come up with something with a better guideline for these providers. And right now it is voluntary. We open up, it's voluntary registration. But if we come up with regulation that says it's a mandatory, then it'll be in future. So I hope I've answered your question.
Thank you.
Jai.
Thank you, Fazila. I think so. The current solution providers, unless means it's not mandatory that they have to get assessed to actually market it,
No.
or like okay. So they can still market it. This will be an additional qualification or a badge on them.
Yeah, no, it's not that. If they come into regulatory lab, they have a chance to co-create the standards with us.
Get it?
And they have a chance to be facilitated. They can come and talk to us, and we do a lot of activities. So that is the difference of those who are in the lab and who's outside the lab.
Get it. That, in fact, my question on handholding or support was actually related to the co-creation, because usually startups do not have much resources, but they can come up with very innovative solutions, unlike somebody who is legacy. But then if they can get the requisite support from the government, and then a bit of expertise on coming up to the reaching the expectations on standards, that will be fantastic. Thank you.
Yep, thank you. So for the next question is from Dr. Bunchai. So are these regulations apply for private healthcare system only? What incentive for company to apply to participate in this sandbox?
Maybe Zaman, you want to answer that?
Okay. Thank you, Dr. Fazila. For this regulation apply for private healthcare system only. For currently, when we started the Reg Lab, we see it as for the private sector. But going on for the second cohort, we during the stakeholder engagement sessions, there are a number of non-government NGOs, non-governmental organizations, non-profits, non-governmental and non-profits also providing some sort of an online healthcare services. So we are seeing into that also. There are currently lots of business models out there, and maybe non-profit models also. So for initially it is for private, but we are looking at more than that also, I think. So for the incentive for the company to apply to participate in this sandbox is firstly they can be handheld, as Dr. Fazila said, be handheld by the regulators, because some of them are in the early stages. They are providing their services, but maybe some aspects of it need to be guided by the government, and we as the regulators also need to see how initially they provide a service or the business models. And I think the main incentive is that it is a platform for collaboration. So if there is any standards or regulations being drawn out of this initiative, then they have a first-hand involvement in that. And secondly, it is the incentive is the publicity lah, because the companies is joined an MOH initiative, so there may be more exposure for them for the public in the public domain.
Thank you, Dr. Farizaman.
What?
Dr. Puncha, I see you unmute yourself.
Yes, thank you. I have a follow-up question. This is very new to me about this kind of the concept, but to my understanding, because of technology that's going very fast, and also there is a very many innovative healthcare services, which is the rigid bureaucrat government maybe not catch up with all those. So the concept of the regulatory lab just emerging like Malaysia or Singapore. But I wonder that when we're talking about the regulation, I know that it's a corroborate to kind of the negotiate something like that. That would like to what should be regulate. So, but at the end of the day, they will have a regulation for every health provider or something like that to follow. And how different between the healthcare, the health platform you call the healthcare service platform, for example, online consulting, and we don't usually we have to can identify licensing and know that the one who at the end of the consulting is licensing, and with the online how can we sure something like that that is a new service. So what difference between the implementation between inside the sandbox and outside the sandbox? If I am the private company, I create a new service like I just said, and the old regulation said that I have to do the service in the hospital or in the clinic. But right now I don't have clinic. I did not register for the clinic or the hospital, but I also provide this kind of on consultant online, something like that, which has never have a regulation before. So if I participate in this, can I practice those?
Okay. I'll answer that question, Dr. Bunchai. Actually, the regulatory sandbox, yes, it's quite a fair, since you said you are first time you are hearing, it's quite a fair new thing. Actually, this is more common among the fintech, where they wanted to regulate the financial services. But when we say sandbox, we're always talking about we want to try out a technology or a solution or a product. For example, sandbox for auto vehicle, for drone, and so forth. This is something new. This one we are just more talking about the services and regulatory. We also have another sandbox, which is the National Technology Innovation Sandbox. So for a product and systems and solution is another sandbox that we do at the agency, at the Ministry of Science and Technology agency level. But this regulatory sandbox is more for Ministry of Health. This is for us. But at the same time, Futurize also does regulatory sandbox for other services. For example, maybe for e-hailing, maybe for services like DNB and so forth. But what is the difference between those who are outside and those who are inside is the inside one, like how Zaman mentioned, you are facilitated, you get the first hand of improving the guideline. You have a lot of things, but since it is still voluntary, there is no sort of difference between the inside and the outside. It's just that the inside one has more facilitation. Tengku Azrul is our collaborator who's here, who's hands are up. Maybe he wants to say something. And after that, I think we have to go to Ibrahim Putra, who also has raised his hand for a long time. So Tengku Azrul.
Okay, a quick one. Thank you, Dr. Fazila. I think I would like to pitch in a little bit about the concept of regulatory sandbox. Yes, Dr. Bunchai, you were right in a way that there is a lot of innovation that is currently moving faster than regulation. So the reason why we have this regulatory sandbox is to look at how the regulator can understand faster the technology so that we can either regulate it properly or even let it self-regulate. Because now we are looking at not all technology or not all services should be regulated. As what Dr. Fazila mentioned, they split the OHS into three. Mostly non-regulated one, slightly regulated, or highly regulated. So we're looking at the number one and number two, where non-regulated and slightly regulated. So when we took all the interests coming from the industry, saying that they're doing teleconsultation, they're doing registration, they're doing queuing, all of those can or cannot be regulated unless we understand the innovation, what's behind it. So yes, Dr. Fazila, as what Dr. Fazila mentioned, in Malaysia, we have National Technology Innovation Sandbox where it looks solely on the innovation part. But when you look at autonomous vehicle, how can you regulate, how can you test a certain innovation where they have no regulation, where the vehicle cannot be on the road? We learned from Singapore, where Singapore has been testing autonomous vehicle for the past 3-4 years, because they have a soft law, a guideline to say that those vehicles can be on the road with a certain condition, precondition met. Same goes with our online healthcare OHS Reg, where previously, as Dr. Fazila mentioned, insurance doesn't want to touch them because there's no regulation, there's no oversight to say that what they're doing is right. So when we started OHS, we took input from the industry, we took input from the insurance, we are looking at regulators, we're looking at policymakers, and how can we move forward better? I think that answers your question, the first part of question, Dr. Bunchai. Thank you.
Thank you.
Maybe Ibrahim?
Good afternoon. Okay, no video. All right. Good afternoon, Ms. Fauzila and and Mr.
Zaman.
Zaman.
Yeah.
Sorry. Thank you for the time. I'm Ibrahim from Indonesian Ministry of Health. Currently, we are on our research to make regulatory sandbox as well. And yeah, we're still developing the guidance for the technical side to implement the sandbox. But what I'm curious about is about how your sandbox may be dealing with certain issues. Like, I wonder how the sandbox may be facilitating issues like healthcare standards. I mean, I see that in your guideline, there is a care standard in the part of healthcare professional standard of care. What is means? I mean, like, there are some healthcare professionals who prefer more to say that online teleconsultations or online interaction to provide healthcare is not that effective. How you manage maybe this expectation by using the sandbox? Because I think it's interesting that there is a part of standard of care over there, and I wonder how the Malaysian government try to make the implementation of standard of care, because I think it's quite challenging side of the telehealth or the telemedicine. The second one, I wonder as well about the permit of healthcare professionals. Are there, maybe I want to know, is there any limitations about permit over how how much healthcare service can be provided for a medical healthcare professional, and how the sandbox deal with the issues that if you are doing it online, you can consult cross-borderly, or maybe having more patients. How maybe the Malaysian government deal with that? We are kind of curious. Thank you.
Okay. That's a lot of question, Ibrahim. But,
I'm sorry.
no
Just-
problem. I will answer that. First, let me answer about the cross-border. That's the easiest to answer. You see, when we did this guideline, we like I told you, it is as of what is regulation today. So we have taken some standards of care from the Code of Professional Conduct, from the Medical Act, or the Nursing Act, or the Allied Health Act. So we have done all the study of all the acts, and we have taken all the necessary clauses that needs to be put in this guideline. So it's not something new. So that is as is today. So when we together we co-create, then we can test it out and see whether we need to change all these existing clauses. So that is what we are hoping to do. So for the standards of care, we just follow whatever the Code of Professional Conduct that is out there. But if the online health service providers have a chance to disagree or say, no, look, these clauses are very difficult for us, can we look? So this is how we're going to facilitate to look at it. So that is for standards of care. But cross-border has been an issue. Even today, we have online service providers who are providing the doctors from overseas, providing services to the patients in Malaysia. So that is not allowed under the current act. You must be registered in Malaysia. So are we going to allow this in future? That is what the regulatory lab needs to answer. So we have this 1.5 years to look into that again. So we have to have a lot of discussion with the Medical Act Council and so forth. So it is quite a challenging. So like the question asked by Alvin, is there a debate or disagreement? Who will win? Yes, you're right. Sometimes government always win. But in regulatory sandbox, we try to mediate between regulators, the secretariat, the three collaborators, between the regulators and also the online health service providers. There are so many regulators and council who in our technical working group. So this is how we are trying to do it. For example, the online service providers are not happy at all about digital signature. They are not happy about current act that limits telemedicine only for follow-up patients. They are not happy about that. They are not happy about doctors must be registered in Malaysia for cross-border. So all the unhappiness we are looking into it. So we really hope we can come to a win-win situation where healthcare service will be provided in a very safe manner. So it's a long process, and maybe together with Indonesia and Singapore, we can all learn together. Yeah, I hope, Ibrahim, I've answered your question. And maybe the next webinar is by Indonesia next year for regulatory sandbox.
Fazila, if I may ask a question. It was part of the previous one regarding the duration it takes for assessing the solutions that is put as entry or registration, like typically how long it takes for a decision. And then the second is like, how is the Reg Lab funded? Like who funds the operations?
Okay.
Anybody has to pay a fee for entry?
Yeah, Zaman can answer that. Zaman, how long it takes for evaluation?
So for the first cohort, because we do not have a baseline, this is the first Reg Lab for the MOH lah in Malaysia. So the evaluation, if I'm not mistaken, takes around 1 month plus minus one, maybe 5 weeks. Because after presenting we have 34 candidates for the first cohort, and after presenting to our committee, there are some some submissions that may need a one-to-one interview lah to gather more information. So it's around for 34 companies, it takes around 5 weeks if this is the first cohort. And for the second cohort, we are targeting around, for the evaluation, maybe it takes around 2 to 3 weeks to that. And regarding, so who funds the operations of the OHS Reg Lab, I think, do the solution providers need to pay a fee? No, they do not need to pay a fee. So all costs are borne by the platform providers themselves lah. But however, if there is any call for a physical meetings, then we may provide the facilities for it lah. But they do not need to pay anything to voluntarily join our regulatory lab.
Yes, Jai, right now, because it is under, we are collaborating with Futurize under the National Regulatory Sandbox, which is funded by the Ministry of Finance. So Ministry of Health right now collaborates, so we don't have to, we also, all the operations is funded by the government, and it's free for the OHS providers to sign in, yeah.
Okay,
Thank
so
you
we
very much.
We have another question in the chat by Mohammed Khair. Like, just querying on how does OHS put in place measures that will help to allow data to be standardized for use in the future, as in HIE, or even fit into the MOH National Digital Health Plan?
Okay, that's a very good question, Kai. Actually, right now, we are not looking into the data yet. Now we are trying to see how we regulate the service, how the business model and so forth. But when it comes to data, under the HIE projects, we have released an API for data to be standardized. But right now it's only mandatory for Ministry of Health. But hopefully, as we are going towards healthcare reform, where the private sector and the non-Ministry of Health public sector also has to follow the standards. So right now it is not mandated yet. Yeah, hopefully in future it will be.
Dr. Fazila, sorry if I may interrupt. Just continuing on the question, follow-up question. Since we call that, you are saying that there is a plan for actually trying to regulate that. Does it fall under the MOH purview, or is it going to fall under MCMC or other ministries, or somehow or another is going to be together?
Okay, for health data or medical data, it's under the Ministry of Health purview. But for the HIE, we only standardize what that needs to be shared and to be exchanged. Otherwise, it's I mean, it's open, you know. So, and also there is also a requirement for data to be sent to my health data warehouse. That is also standardized. But outside anything that is not shared, there's no standardization for the time being.
All right, Dr. Puncha, do you have a follow-up question? I see in the chat that you asked about standards as well. Do you want to continue the question here?
No, I saw another 2 questions before me, just around those, and I have another kind of the new topic questions.
Okay, then I'll go to Pak Anis first. How is the composition of review committee? How many of the members and the proportion of the government and non-government?
Zaman, you're talking about the technical working. I'm assuming this is about the technical working group. Am I right?
It says review committee.
Yeah, it's the technical working group.
Yeah.
Zaman, you want to talk about the composition?
The composition of the review committee, I think, okay, when we evaluate the companies, we have the technical working group to evaluate all the aspects of the participants lah. So we have 16 organizations lah, including the professional bodies, that includes the other divisions such as family health, the pharmacy, and also all the we have the legal advisor, us, the planning division, other agencies such as the outside MOH, such as the National Cyber Security Agency and the Personal Data Protection Department, and also the Malaysian Productivity Corporation lah. regarding the building up of new AeHIN regulation in Malaysia. So together with Futurize, we have 16 seats for the technical working group that reviews does the evaluation. Does it answer that question?
Is there any member from the private join as the technical working group, or only from the government only, the members?
The technical, actually, I don't know whether when you say when the councils, you see the council itself, they may have private, they may have academia inside there, you see, so the seat is for the council. So it is not, it does councils, I don't know whether you want to call it semi-government or quasi-government, but private as individual is not in the group right now, yeah. But all the online health service providers are all private people. But during the industry consultations and so forth, we have the industry, we have private sectors, we have insurance providers in our workshops and consultation, but not in the working group.
Okay, there's another question from Edward Sutanto. Can you highlight several lessons learned or common pitfalls from Malaysian experience for countries that will implement RegLab?
Right now we just started, so that's I would say it's very difficult in the sense because we are dealing, it's done by planning division. We are not, the secretariat is not regulators. Futurize are not regulators. So we are more open-minded, but dealing with regulators is not easy. So trying to be the mediator between a regulator and the private sector is not easy. So I would suggest that if other countries are trying to do regulatory lab, it must be someone who's independent, it must not be a regulator. So then you can be not biased to any side. So that is one. And two is, there's a lot of things we are learning, but we also look up a lot to Singapore, how they have done it. So we do a lot of sharing of knowledge with them. So right now, I don't have much in terms of pitfalls and everything. But one thing I would say, it's tough, but we must be persistent and and move ahead and try not to hinder innovation. I think that's very important.
Thank you for that. I think now it's Dr. Bunchai's turn to ask his question.
Thank you. Actually, my question is related how the government, you said the planning division, how they come up with this idea to have the regulatory sandbox. What kind of the pain point or the force that get Malaysia, Indonesia, and Singapore doing this? Thailand also have this kind of the same problem, but they also just independently create the regulation, like the Council of Pharmacy. They just created the telepharmacy, the Council of the Medical Council. They just come up with some kind of the ridiculous regulation, guideline or something about the telehealth, and they don't talk. But when I see the composition that Faru Saman, right? Faru Saman talking about the composition, all of those are regulators. So two questions. One question is that what incentive or what drive the government or the Ministry of Health or the to kind of thinking about this? I saw in the fintech, but in the fintech they also have several challenges. They can come up with some kind of the only one small one topic. But in health, to my experience in the last 2 years, they also just independent. I am the powerful, something like that. So I want to regulate my profession, and it's just a mess. That two questions.
Okay, I think Malaysia, in fact, regulatory, it all started with the national regulatory sandbox for the fintech, because you know finance industry is very highly regulated. So I think it started with the central bank. So that's how Ministry of Finance set it up, with Future Rise being the lead. So from there, slowly the other sectors starting to look into regulation. How do we innovate, how we approach regulation? So that's how it started. Malaysia also started before COVID, the national technology sandbox, because at that time we started robotics, we started drone, autonomous vehicle, you know, and then slowly it started to grow and healthcare start coming in. Usually healthcare is the last to come in all this. But right now, you know, after COVID, technology, the digital transformation in healthcare is far ahead. And so I think this is required. And as I mentioned earlier, it is also a bottom up approach, because the providers themselves, they came to us knocking our door, please help. Because the insurance company are not reimbursing our patients because it's not recognized by Ministry of Health. And also our investors want to know if Ministry of Health will recognize them. So it is multi approach that helped brought us to this. And then, but still we didn't know how to do. So we commissioned a study by a consultant, and then a lot of workshop, a lot of industry consultation. So even the industry proposed a regulatory sandbox. Let's all get together, co-create standards, you know, like how you do when you do ISO standards, where people come together. So that is the history, basically how it all started, Bunchai. But now I think it's becoming popular everywhere, every country you are hearing about regulatory sandbox. But it's not only health sector, all sectors are doing.
Yeah, I would like to add a bit on the Dr. Bunchai comment on regulator not talking to each other. I think we faced that in our multiple meeting, but luckily for us, the OHS Reg Lab is the platform for everyone to trash out. Same issue that you have in Thailand, Dr. Bunchai, where pharmacists not talking to the medical council, for example. So we had that discussion in the sandbox to trash it out, to look at what is the best for the private players to grow the industry. I think that is one of the lessons learned that we got from our initial stage of this OHS Reg Lab, where we need to have an open platform for everyone in the secretariat to basically trash out and to look at how to resolve stuff so that the development of the industry not stunted. Thanks.
Thank you.
And Buncha, I will think that our biggest achievement today is we managed to bring all the regulators into one platform to discuss and to talk and to which we were not able to do it before. Many years we are not able to do. So today, thank God we are able to do that. So that is a big achievement. Next is to make sure that we can look into the guideline all together and create a better guideline for the online health services for the people.
Thank you. There's one question from Dr. Alvin. Does government set the use case or the stakeholders?
I don't understand the question.
Dr. Alvin, can you?
So the sandbox is actually solving a problem, right? So yeah. So who puts up the problem to solve?
The industry put up the problem. Just now Zaman has shown what are the challenges. So industry put out, but the regulators also have challenges with these industry players because the regulators feel that they are not following some of the standards and guidelines. So there's always enforcement issues, bringing to court, you know. So it's both ways.
Yes. And you mentioned also that the first time that the regulators came together, but who was doing all the hard work of bringing them together? I suppose there's like one person who is working well beyond his or her.
Maybe maybe Zaman can answer. I don't know how to answer that.
I don't know how to answer that too, Doctor.
Because
But
all of us actually in the planning division together with Futurize, I think we the collaborate both the secretariats, we are the sort of who actually bring people together and
Yes.
really supported by our director general because
Yeah.
he was the one who first initiated it with the industry. Yeah.
So I think that's the leadership that we're talking about in AeHIN. At some point, there will be difficult things that need to be done,
Yeah.
and there's a leader who will just inspire people to
Yeah.
just keep on going. I think that's that's
Yeah.
very important, because if that leader gives up, then all of the followers will say, well, the leader is not actually hot about it, so might as well do something else.
Yeah, but
Yeah.
we could not have done it if without the collaboration with Futurize because it
Okay.
takes a lot of effort and also to do this. Yeah. So
Thank you.
thank
Wonderful.
you.
Wonderful sharing, Dr. Fazil. I think we're at the top of the hour, but now we're looking at a series of regulatory sandboxes. I think we can invite different countries on rotation. Yeah.
Yeah. Yeah.
Can I ask a quick question? I lost about how future lies created.
That one maybe Azrul can
Okay.
answer.
Dr. Bunchai, when we were created out of the height of all the innovation that start coming in without proper regulation. If you remember when Asian got invaded by Uber, where they start coming in, start terrorizing the regulation without any proper guidance or oversight from the Ministry of Transport from any country. So they are converting taxi to become a ride hailing without proper regulation. We sit down, we look at that cannot be happening. Because when we start to change the industry become too big. The Uber themselves back then become too big. Then it converted to Grab, where we look at that is not healthy, especially for the safety, for the regulator to impose any safety measure, because the company, when they're big, they're driven by profit. That's fair for every businesses in the world that's driven by profit. They look at how to cut corners. But when the current industry cannot sustain due to the new technology start coming in, we need to look at how to either regulate them, to tell them to follow a certain guideline. That could not happen. So we decided National Regulatory Sandbox should be the core of any initiative that is looking on how to regulate innovation. So when we, like what Dr. Fazila mentioned, we look at digital healthcare in Malaysia back in 2017. It's huge, but nobody is looking at that. The policymakers say, let them run first, later we look at that. But when we see DG suddenly say, yeah, that's a good idea. Let's look at how can Ministry of Health reduce the number of people going into clinic kesihatan. Clinic kesihatan is our clinic, government clinic. So how can Futurize help? So we have a standardized guideline or template on how to get people together, how to draft a soft law or guideline with the help of the stakeholders. So I think that is how we started back in 2017 to look at how to regulate the innovation and how to support the startup industry in Malaysia.
So
Is that
Futurize is government?
Futurize is a company created under Ministry of Finance. We were given a seed fund for the first 10 years. So we need to go and look for ministries on how can we spend that fund together, how to run National Regulatory Sandbox. Our National Regulatory Sandbox is not only for Ministry of Health. We have National Regulatory Sandbox with MOT now. We have about 3 or 4. We're starting a new one next year with MOT as well. So MOT, same with MOH, they look at us as their partner to look at how can they better understand the industry. At the same time, how can they regulate the industry without intervening the growth of the industry.
I see. So like Alvin said, it's the leadership and it usually coming from
Yes.
money first.
Money and the Director General. And for MOT, yes, we do speak to the number one in the ministry. They say that, yes, I think this is a better way to regulate rather than micromobility, for example, the e-scooter. Ministry of Transport issue a blanket ban. When you do a blanket ban, you don't know that maybe in Malaysia, we have 3 major e-scooter company. One of them is funded by a government fund. So they basically blanket ban a government funded startup. That's not right. So we need to have again, like what I mentioned earlier, National Regulatory Sandbox is a platform for everyone can have their say to see how the policymakers should craft the industry, how the regulator should look at the industry, whether to have a very strict regulation or let the industry run by themselves with a proper guideline.
Thank you.
Thank you.
Yeah, I think we are all over time a bit. Yeah, thank you everyone for the fruitful discussions. I think everyone learned something from this Malaysia experience. So I would just like to share that we also have another webinar tomorrow on digital health governance model recommendations for Thai health systems. Same time at 9 p.m. Manila time. The speakers are at Anawat and Kaponporn. So we'll see you tomorrow. Thank you everyone for your participation today.
Thank you.
Thank
Good
you.
night.
Good night.
Good night,
Good night.
everyone.
Thank you.
Congratulations,
Bye-bye.
Malaysia.
Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you.
Thanks, everyone.
Bye.
Bye.